The origin of the diaphragm is the xiphoid process at the last 6 ribs and the lumbar vertebrae. The insertion is the central tendon. The joint associated with the diaphragm is the ribs, and the action is to increase vertical dimension of the thorax. Number 40 of the muscle chart is the rectus abdominis. It is pinned on the cadaver in 2 locations. On your list you will see them as 14 and 15. The origin of the rectus abdominis is down here at the pubic crest. The insertion is here at the xiphoid process and 5 through 7 cartilage of the ribs. The action of the rectus abdominis is to flex the spine and compress the abdomen, and the joint associated with it is the spine. Right here what you are seeing is the external oblique, number 41 of the muscle chart, and it is pinned as number 16 on your list for the cadaver muscles. The origin of the external obliques are at the anterior and inferior surface of the lower 8 ribs. They insert at the linea alba and the lower 4 ribs. The joint associated with the external obliques is the spine, and the action is for flexion and rotation of the spine. Now the internal obliques are number 42 on the muscle chart and are also pinned on the cadaver. You will find them on the list at number 17. The origin of the internal obliques is the iliac crest and the lumbodorsal fascia. The insertion is the linea alba and the lower 4 ribs. Again, the joint for the internal obliques would be the spine. And the action is to flex the spine, compress the abdomen, and also to rotate the spine. We are now at muscle number 43 of the muscle chart, the transversus abdominis. That is also pinned on the cadaver, number 18. The origin of the transversus abdominis is the iliac crest, the lumbar fascia, and the last 6 ribs. You can actually see all of those origins very, very clearly in this picture. The insertion of the transversus abdominis is the linea alba and the pubic crest. The joint to be associated with this would be the abdomen, and the action of the transversus abdominis is to compress the abdomen. Right now we're looking at the gluteus maximus, number 44 on the muscle chart. The origin of the gluteus maximus is the iliac crest, the sacrum, and the coccyx. The insertion is the iliotibial tract of the tensor fascia latae and the gluteal tuberosity of the femur. Now you should take note of the iliotibial tract because that is mentioned in the list of pinned muscles on the cadaver as number 20. It's not really a muscle, it's just an important insertion. The joint associated with the gluteus maximus is the hip, and the action is to extend and rotate the femur laterally. Number 45 of the muscle chart is the gluteus medius. The origin is the ilium. And the insertion is the greater trochanter of the femur. The joint associated with the gluteus medius is again the hip, and the action is to abduct and rotate the femur medially. Now we are looking at the gluteus minimus. The gluteus minimus is number 46 of the muscle chart. The origin is the ilium, and the insertion again is the greater trochanter of the femur. Also, again, the joint associated would be the hip, and the action of the gluteus minimus is to abduct and rotate the femur. Now we are looking at the tensor fascia latae, number 47 of the muscle chart. It is pinned on the cadaver. You'll find that on your list under number 9. The tensor fascia latae has its origin in the iliac crest. The insertion is the iliotibial tract. So again, take note of that important insertion site that is also pinned on the cadaver. The joint associated with the tensor fascia latae would again be the hip. The action is to flex and abduct the femur. Here we have a lot of adductors. Right now we are focusing on the adductor longus, number 48 of the muscle chart, and it is pinned on the cadaver, number 26 on that list. The origin of the adductor longus is the pubic crest and pubis symphysis. It inserts at the linea aspera of the femur, and the joint associated with the adductus longus is the inner thigh. The action is, of course, to adduct, but also to laterally rotate and flex the femur. Here we are looking at the iliopsoas muscles. Number 49 on the muscle chart is the psoas major. Right here you'll see the origin of the iliopsoas, psoas major, is the transverse processes and central of the lumbar vertebrae. The insertion is the lesser trochanter of the femur. The joint associated with the iliopsoas is the hip, and the action is for flexing and rotating the femur laterally and also to flex the vertebral column. The iliopsoas iliacus is number 50 of the muscle chart. The origin here is the iliac fossa and the crest. The insertion is the tendon of the psoas major. The hip is also the associated joint with the iliopsoas iliacus, and the action would be for flexing and rotating the femur laterally and flexing the vertebral column. Right now we are looking at the pectineus. This is number 51 of the muscle chart. The origin of the pectineus is the fascia of the pubis, and the insertion is the pectineal line of the femur. The joint associated with the pectineus is the inner thigh, and the action would be for flexing adducting, and rotating the thigh laterally. It is now time to explore the hamstrings. Number 52 of the muscle chart is your biceps femoris. The origin of the biceps femoris is the ischial tuberosity and the linea aspera of the femur, and the insertion is the head of the fibula and the lateral condyle of the tibia. So as a reminder, the origin is in red. You have the ischial tuberosity and the linea aspera of the femur. And then in the blue, we're looking at the insertion. That would be the head of the fibula and the lateral condyle of the tibia. The action of the biceps femoris is to flex the knee and extend the thigh. Continuing with the hamstrings, number 53 of the muscle chart is the semitendinous. The origin of the semitendinous hamstring is again the ischial tuberosity. And the insertion is the proximal end of the tibia. The action is for flexing the knee and extending the thigh. The joint associated with these are going to be the knee and the hip. Number 54 of the muscle chart is the semimembranous, still part of the hamstrings. The origin, again, is the ischial tuberosity. And here we have the insertion, the medial condyle of the tibia. And this is for flexing the knee and extending the thigh. We are at number 55 of the muscle chart, nearly done. This is the gracilis. It is pinned on the cadaver, number 27. The origin of the gracilis is the pubic symphysis and the pubic arch. You can see that here. The insertion is the medial surface of the tibia. The joint associated with the gracilis is the knee and the hip. And the action is to flex the knee and adduct the thigh. This is the sartorius muscle, number 56 on the muscle chart. It is pinned on the cadaver. You will find that as number 25 on your list. The origin of the sartorius is the anterior superior iliac spine. And the insertion is the medial surface of the tibia. The joint associated with the sartorius is the knee and the hip. And the action is for flexing the knee, flexing the thigh, and rotating laterally. We're now going to take a look at the quadriceps. They are all pretty similar. The first one we're going to talk about is the rectus femoris. This is number 57 of the muscle chart, and it is pinned on the cadaver, number 23. The origin of the rectus femoris is the anterior inferior iliac spine. And it inserts at the upper border of the patella. The action of the rectus femoris is to extend the knee and flex the thigh. The joints associated with the rectus femoris are the knee and the thigh. The next in our list of quadriceps is the vastus lateralis. It's number 58 on the muscle chart. Associated is the knee. We are now looking at the vastus intermedius, still part of the quadricep group. The origin is the anterior and lateral surface of the femur, and it inserts at the patella and tuberosity. The action is again extends the knee. And finally, we have the vastus medialis, number 60 of the muscle chart, number 22 on the cadaver. The origin is the linea aspera of the femur, and the insertion is the patella and tibial tuberosity. The action is to extend the knee. The main difference in these quadriceps is that the rectus femoris is the only out of these four that has an insertion point in the hip. You'll notice the others all they all originated at the femur, but they all insert over the patella into that tibial tuberosity. This muscle here is the gastrocnemius in the back of your calf there. This is number 61 of the muscle chart, and it is on the cadaver. It's number 32. The origin of the gastrocnemius is the lateral and medial condyles of the femur. And the capsule of the knee. The insertion is the